It's somewhat complex in that we're embedded in the shelter system, but we are not part of the shelter system. So we don't really have control over who gets a bed and who does not get a bed. And there's a certain shelter system that has to be followed, a protocol that has to be followed. So we will, when we get the heads up from outside services saying so-and-so is coming into the shelter, we will then keep an eye out for that. So we'll engage with shelter staff, and that's where that relationship is really, really important, and say, hey, we're expecting so-and-so to come and get a bed here. Can you alert us when they arrive? And then we'll work with that person. And I think that our unit is really, really big on just kind of walking around the shelter and engaging with everyone just to see. And to bond with folks, and just to see if we missed someone, or if someone was missed in the referral process, or maybe they didn't present that way when they first came in. If they're isolative, to catch those folks with severe depression, and that proves to be helpful.
I think our case management agency is different from typical targeted case management agencies for a few reasons. Our population is very specific that we work with, and I look at us as kind of, and correct me if I'm wrong, Ann, is we're kind of that entry level into the mental health case management system. So we do a lot of engagement and trust building when somebody's coming fresh off the streets into an agency, especially with the homeless population. Trust is a huge thing that a lot of times you hear, I don't want to go into the shelters, I don't want to do that. Our agency will go out and we partner with homeless outreach and other organizations to go and actually send a case manager out to physically talk to somebody and be like, listen, I'm going to be there beside you in the shelter system. This is the next step that you have to go. So engagement's huge. Also, what makes our agency successful, I feel, is we use a lot of non-traditional approaches to case management, which can be anything from as simple as buying somebody a coffee and sitting down and talking and kind of hearing their story and just listening to them, not cutting them off, not being like, if you test positive for drugs, we're going to kick you out of the shelter. It's okay. We go more of a harm reduction approach to that, which sometimes makes our job very difficult when we partner with facilities, but also we strive on building those partnerships so we do have that leeway, especially with outside agencies, because we know that we're not going to gain this trust with just us ourselves. We have to work with systems and approaches.
Our credibility is really something that I value, because anywhere I go, when you mention FaSST-Connections, people immediately trust you. They're like, okay, you're with FaSST. Okay, so they believe that, you know, what I'm saying is true. I may have not one proof of evidence, I may not have, and I may not even be wearing my ID that day, but just the fact that I, you know, mention FaSST-Connections, they trust me, and that they trust that what I'm saying is true.
I think the really unique part of our service that is newer since becoming fee-for-service is the continuity of care part. The fact that we can continue to follow someone outside of shelter, go with them in the community, and really help them integrate into the community, find and establish natural resources for them, reconnect them with family, help them make friends by introducing them to various community supports like the Y or the library, things like that, like drop-in centers, utilizing those supports, and teaching them how to use public transportation independently. And oftentimes we tell our workers, think of working yourself out of a job, naturally working yourself out of a job. So we want you to work with this person until you no longer have to.
We do updates as far as where they're at, what their goals. We work with our program analyst, the homeless outreach teams. Everybody is really involved with the homeless situation going on in Pennsylvania. And I think everybody does, you know, do their hardest to get it to where everybody feels it should be. And that is something as far as women moving out, getting, you know, either independent living or transitional living, but being able to be independent. You know, a lot of times I think before women were moving out and they were just coming right on back. It was like a rotating door. Now I see that they're moving out and they're staying out, they're independent. I get a lot of calls, women will come back and see me and, you know, let me know how things are going. And it's just great to see that, you know, it's not a revolving door anymore. Like we don't want to see you again. Like, you know, that's a good thing.